Important issue to another. With South Africa leading with the highest number of tuberculosis cases globally, experts in this field are now preparing for the 4th TB conference to lower the scourge. The event is set to look into detection, prevention, and of course the treatment of the disease. To tell us more, we are joined in studio by the chairperson of the conference, that Professor Bavesh Kana, who also is from Wits University. It's good to have you. Welcome to the program.
Thank you.
TB, you and I saying that TB not getting enough attention, and one would think it would. It's one of the biggest killers in the country. Talk to me about why you feel that not enough is being done on the education of TB.
You know, Leanne, tuberculosis claims more lives in South Africa than anything else.
Yeah.
Based on death certificates, more people die of TB in this country than anything else. Yet the disease doesn't occupy a sufficient amount of the public consciousness. We don't have people routinely talking about tuberculosis. When we have World TB Day, there's nowhere near enough effort put in as one compares to World AIDS Day. And just from a general advocacy perspective, there's a very poor understanding of what patients actually go through when they have TB, when they have to go through the system, when they have to be on treatment for 6 months, if they develop drug resistance. These are incredibly complex issues, and there's a very limited understanding with how we deal with this.
Yeah. Well, would you say in a way that that we're losing the battle to manage the cases of TB that we have in the country? As you say, it is the biggest killer here.
Most definitely, and I think it's particularly relevant that you've had Bindile on. One of the main drivers of tuberculosis in South Africa is HIV infection. So when one is immune suppressed the way one is when one is HIV infected, one of the biggest risks that one has is developing tuberculosis. And because we have so much TB in South Africa, HIV infected individuals represent a particular vulnerable population. And then the second problem we have is in this country we're now seeing a resurgence of various forms of drug resistance, and these are incredibly difficult to treat. They require drugs that don't work as well as the regular drugs. There are side effects, there are complications, and so when one considers those two things, the massive HIV rate that we have in this country together with drug resistance, we're most definitely on the back foot.
Yeah. What are we doing about that? I mean, in terms of this drug resistance, you mentioned the treatment that's available out there. Are we addressing it adequately or not really?
Again, I think that we are addressing it as a country, but not adequately. We are bringing on the availability of new treatments, second-line antibiotics, and South Africa has played an important role in bringing to market some new drugs. Bedaquiline is a good example, and also repurposed drugs. So these are drugs that have been used previously for other diseases, but they're now being brought into the HIV and TB field. Linezolid is a good example, but when one looks at linezolid, one tablet of linezolid costs 700 rand.
Wow.
So again, this becomes economically not feasible. We don't have the regulatory clearance to import a generic. So there's a systemic issue that we need to address. If people need linezolid, there isn't free access to it.
I know that our health minister is fighting for the generics. He really is. And are you in agreement with what he's trying to do?
Most definitely. Most definitely. We need to make these drugs accessible to the people who need them.
Yeah. He's going to be closing the conference?
Yes. Minister Motsoaledi will be arriving on Friday. He will close the conference and provide a summative report as to what is the future plan to actually address the TB HIV epidemics.
But what I'm gathering is something needs to happen and quite fast, because are there statistics how many people lose their lives to TB? Do you know these offhand?
So globally, you're looking at about 1.4 to 1.5 million people who die of tuberculosis every year. This is despite the fact that we have a vaccine and we have antibiotics. This represents one of the biggest public health failures in human history. In South Africa, we're looking at about 500,000 people infected with TB, and to give you a sense, that's like filling Soccer City 5 times over.
So we've got 500,000 in South Africa, and 1.5 million in the world. Dying
in the world. And in terms of incidence in the world, you're looking at 8 to 10 million people who are infected.
Sure.
It's a massive disease.
This conference, who is coming? Who's attending? Who's talking? And what comes out of these conferences? Is it just a talk shop, or are there actions that are taken?
No, our approach to this meeting is that it has to be a game changer. This conference has to constitute a turning point in the history of TB and HIV. We've taken an approach of integrating all the efforts, integrating disease treatment, disease prevention, disease management, and then overlay this with a very, very strong patient advocacy component. So who's attending? We're having the academic sector represented in strong non-governmental organizations, local, national government, and then we have international people representing the Bill and Melinda Gates Foundation, the World Health Organization, and other important bodies.
Excellent. I can see here we've got Derek Hanekom, who's going to be talking as as well. Adila Hassim, Chris Dye. Where is it taking place?
It's taking place at the ICC in Durban.
Okay. Yeah.
Yeah, and it starts tomorrow afternoon.
And it goes on until?
Friday afternoon.
Until Friday afternoon.
Yes.
All right, so lots and lots of people speaking. David Russell, Gary Martins, who's a pharmacologist, Gerald Friedland, who is an MP. He's from Yale University. Curtin Dida, Willem Honeycomb as well. He's the director of the South African TB Vaccine Initiative. Dr. Nazir Ishmael, he's from the Center of Tuberculosis with the National TB Reference Laboratory in South Africa, and many, many more that are going to be talking about this. And action, as you say, is the plan that's going to come out of this. Thank you for talking to us. And for more information, can you visit or just email? I see there's the info at TB Conference.
There is a website, www.satbconference.co.za.
SATB Conference.
And there's a Twitter feed too, #SATB2014.
Excellent. Thank you very much for talking to us here
on
the program. It's been a pleasure having you here. And that was Professor Bavesh Kana, who is the chairperson of the conference, and he's also from Wits University. Right, let's take a break. We'll see you after.